everyone. A very warm welcome to all NEET PG, INI-CET, and FMGE aspirants, and of course, MBBS prof students as well. This is Dr. Shanmugapriya, your PrepLadder faculty for biochemistry. And I'm super thrilled to have you all here for this Ask Me Anything session. This is your free space, right? This is your safe space for you to ask every single doubt of yourselves. And whether it is about biochemistry concepts, or it is about high yield topics, or it is about exam preparation strategies, or even about how to answer an MCQ. Yeah. So start shooting your questions here on the live app. And no question is too silly. No question is too basic. So feel free to ask any of your questions. And my aim for this session is to help you build that concept, right? Build that clarity and confidence in biochemistry. Yeah. So with that introduction, let's start the session now. And before you start shooting all these questions of yours, in the last 2 to 3 days, we have been circulating some Google Forms. And through those Google Forms, we have collected few questions of yours. So let me take that chance to answer those questions for you first. Okay. So give me a moment. Yes. So the first question that I received is how to learn in a way like whether I should finish all the topics taught in the same day or can I go slower? Yeah. So the answer to this question is please learn on the same day, right? Because how many ever times a particular topic is being discussed in detail during the session, all that gets established in your memory is short-term memory or recent memory. And it's your responsibility to convert that short-term memory or recent memory to long-term memory. Now tell me, when should you convert that short-term or recent memory to long-term memory? Before the short-term memory vanishes, right? And when does it vanish? It vanishes the very same day. Okay. So what would be prudent? It would be prudent if you learn all the topics on the same day. Suppose you're watching a video session on a particular topic. I would recommend that you read the notes on that topic very same day, memorize all facts, recall all facts, work out MCQs, again recall all the facts on the same day. So if you leave few days in between, then the short-term memory vanishes and it will be like starting from the scratch. So answer to this question is learn the topic on the very same day. I hope it has answered your question. Yeah. Now the next one. Is rapid revision enough for FMG? Be it for FMG or NEET PG or INI-CET, if you have a time crunch, then what I would recommend is, yes, watch all rapid revision videos of all the subjects. But along with that, I would recommend that you also watch LRR session, which is available on PrepLadder YouTube channel. Along with LRR, always try to watch image-based questions. So all faculty of all 19 subjects, we have done LRR session and image-based question session for all our subjects which are available on PrepLadder YouTube channel. So finish rapid revision, watch LRR and image-based questions. That should cover most of the previous year questions for all the subjects. Yeah. So that's about the next question. Now the third one, I would recommend that all of you keep it live and interactive. So please post as many questions as possible as you're watching the session. Yeah. So how to remember the theory of biochemistry, right? This is an interesting question because generally we perceive biochemistry as a volatile subject, right? We think of biochemistry as a subject full of facts. And let's not even get into that aspect. What I'm going to tell you now is, be it biochemistry or any subject, right? How to remember the theory part. There is no shortcut to memory. It is just about repetition, right? When I say repetition, to be very precise, it's all about spaced repetition. Okay. So what do you mean by spaced repetition? The entire PrepLadder app is based on this. So what should you do? You should watch a video on a particular topic. Once you're done watching that video, immediately start reading the same topic from the notes. Okay, that is again a repetition. After you're done reading the notes, I want you to work out MCQs which are given based on that topic. Okay, so you're done with one topic. What are you going to do? Then you go to the next topic. And in PrepLadder app, for every module, right? When I say module, for every division, we have given PYQs. For example, if it is cell and carbohydrate chemistry put together for these two topics, we have given previous year questions. So work out those previous year questions. Again, you're repeating the same fact and the same concept for the third time. That is not enough. What are you going to do? You're going to write grand test periodically. And as you write grand test periodically and as you review the grand test answers, you're going to again revise same fact and same concept. So this way you keep repeating a particular topic multiple times. That is when it gets registered in your memory. Okay, so I'll give you an interesting fact about the way memory works. Your brain resists storing information. Right, this is one of the forms of evolution of brain. Your brain resists storing information. So what are you supposed to do? You're supposed to overcome that resistance. To overcome that resistance, all that you will have to do is repeat it multiple times. Okay, so apart from this, I would also like to tell you something. Your brain stores only what you like. Yeah, your brain stores only what you like. So first start liking the process of learning. Only then it gets registered, right? This is applicable particularly to biochemistry. If you have a hatred towards biochemistry, then every time you learn biochemistry, it becomes very difficult for you to memorize it. So start liking the subject, start liking the process of learning, repeat it multiple times. And of course, you can have shortcuts like mnemonics, but you can have all those mnemonics after you have understood those concepts. Okay, so follow all these. You will be able to memorize any theory, not just biochemistry. It can be pharmacology, it can be microbiology, it can be medicine. It is all about repetition. Okay, and it's not just about repetition. Please don't forget about something called as active recall. Right? What is active recall? Do not be passive during the learning process, right? Like you're watching the video, you're just listening to the lecture, and you think you would have registered everything in your memory. Take it from me, that does not happen. Do you understand this? That does not happen because it has to be an active recall mechanism. So when you're watching the video session, when the faculty is giving you a fact, start actively getting involved in the process by thinking about it. Right? When the next concept is being discussed, get involved in active recall. So first he or she is teaching you a fact and then he or she is explaining your concept. So apply the fact and try to understand the concept. You have to be actively involved in the process. Okay, and every time you work out MCQ, you're actively recalling the information. So it's all about spaced repetition. It's all about active recall that will help you to memorize any theory. Okay. Now, what areas should I concentrate more on for INI-CET? What do you think should be the answer for this? Okay, let me break this bubble for you, right? All along you have been thinking that the topics that you need to learn for NEET PG, the topics that you need to learn for INI-CET, the topics that you need to learn for FMG are different. So that is a bubble. Let's break it. Okay. Be it NEET PG or INI-CET or FMG, topics would remain the same. What is going to be different? The way questions are framed might be different. Okay. If it's a NEET PG MCQ, the question will be more or less straightforward. It can be integrated. It can be a case-based MCQ. It can be an image-based MCQ. But if you look at the question, it will be a direct question. It is asking you for management. It is asking you for an investigation. It is asking you for a diagnosis. Whereas if it's INI-CET, it will be completely conceptual, wherein they expect you to think. Yeah. For example, there are MCQs wherein they have asked you about in decompensated liver disease, which of the following is true. Okay. And they would give you choices like the elevation of ammonia. Right, which everybody knows that there is elevation of ammonia. They don't start there, stop there. What they give, there is a decrease in alpha ketoglutarate availability. There is an increase in the rate of electron transport chain. Okay, And then they would give you there is a decrease in the rate of ATP production. If you see, each and every one of these choices by itself is an MCQ. You should know S in decompensated liver disease, there is an elevation of ammonia. Because ammonia uses alpha ketoglutarate, yes, there is a reduction in alpha ketoglutarate. Because ammonia sequestrates hydrogen ions, there is a decrease in the rate of electron transport chain. Because there is a decrease in the rate of electron transport chain, there is a decrease in the rate of ATP production. Okay, so decompensated liver disease, all are true except, if that is the question, your answer should be increase in the rate of electron transport chain mediated oxidative phosphorylation. You should know that is a false statement. You will be able to answer this only when you have learned the topic conceptually. Okay, that is the difference. Hi Dipan Vita Sarkar. Hi Sarkar. Yes, I will tell you. I'll definitely give you an answer for this question. That's a great question. What do you see here? Topics would remain the same. Only the way you learn has to be different because the way questions are framed will be different. Otherwise, for both NEET PG and INI-CET, what are the topics that you should focus on? Obviously, inborn errors of metabolism, right? Do not skip inborn error of metabolism. You'll have to have a very strong understanding in biochemistry. And then they always ask you image-based questions on enzyme kinetics. So you need to know all about enzyme kinetics, type of enzyme inhibition, the graph that needs to be drawn. Okay. And then genetics. You must have seen that INI-CET, they show favoritism towards genetics, right? And in genetics also, they ask you about application aspects of genetics. I will tell you about the topics that you need to cover in genetics for INI-CET soon. For now, genetics you will have to learn. And then vitamins. So many questions are asked on vitamins and INI-CET. So these are the must-know topics for INI-CET. Okay, and let's answer Sarkar's question here. Difference between PCR and FISH in diagnostic purposes, right? So excellent question, that is PCR is a molecular diagnostic technique. Please understand, this is a molecular diagnostic technique, meaning you're diagnosing something at the molecular level. What do you mean by molecular level? It is not at the chromosomal level. It is not even at the gene level. Within the gene, you're trying to identify sequence alteration. For example, point mutations, right? Point mutations or deletion of one nucleotide sequence. So this is at the molecular level. It is not at the chromosomal level. It's not even at the gene level. It's at the sequence alteration level. That's called as molecular diagnostic technique, and that is PCR. Okay. Whereas what about FISH? FISH is a cytogenetic technique, right? What is a cytogenetic technique? This is about detecting chromosomal aberrations. What do you mean by chromosomal aberrations? Suppose you're trying to understand if there is trisomy 21. Okay, trisomy 21, wherein there is copy number variation of the entire chromosome. One entire chromosome has been added to a person, right? This at the chromosomal level. Or whenever you are trying to understand about translocation, right? What do you mean by translocation? BCR-ABL translocation. This is at the chromosomal level. Or micro-deletion at the chromosomal level. Prader-Willi syndrome, right? So for these purposes, so what are the indications for FISH? FISH is used only to identify chromosomal aberrations like copy number variations, structural alterations like BCR-ABL translocation, and micro-deletion. FISH cannot be used to detect point mutations. To detect point mutations, it has to be PCR. Is that clear, Sarkar? Yes. Cofactors in various enzymatic reactions with their significance in disease level. So this by itself is a huge topic, right? So cofactors in various enzymatic, you have a long list of cofactors. I recommend that you watch a shorter video on minerals, right? On minerals in the regular video session. So please watch that, and that will help you to understand this. Apart from that, what I can tell you is you will have to learn about copper. Elena Chauhan. Yes, I will tell you. So Sarkar, so you will have to learn about copper. You will have to learn about magnesium, right? You will have to learn about zinc. Yeah, this is essential. So if you learn about these three cofactors, then you would have covered almost everything. Okay. So copper is necessary for tyrosinase. Okay, copper is necessary for tyrosinase. It is also necessary for superoxide dismutase. Okay, so if you learn this, you will know why copper deficiency present with hypopigmentation. When tyrosinase is not active, melanin cannot be synthesized and that causes hypopigmentation. Superoxide dismutase, if it is not active, then what happens to RBCs and WBCs? You know, superoxide dismutase is supposed to act as an antioxidant mechanism here. And that is why you see anemia, neutropenia, right? So that is all you need to know about copper. So whenever you learn something in an applied manner, you will be able to retain it in your memory. Okay, magnesium is necessary for kinases. Elena Chauhan, I'm going to answer you that question. Magnesium is necessary for kinases. If you look at zinc, zinc is necessary for carbonic anhydrase. Yeah, it is necessary for carbonic anhydrase, ALA dehydratase, and carboxypeptidases. Okay, also remember alcohol dehydrogenase. Zinc is necessary for carbonic anhydrase, ALA dehydratase, carboxypeptidase, and alcohol dehydrogenase. So these are the cofactors that you need to remember anytime. Okay. Now to answer why Km and Vmax both decrease in uncompetitive inhibition. So this has been explained in enzymology in PrepLadder video. 1 second, let me add one page. So what does uncompetitive inhibitor do? So normally enzyme reacts with substrate to form enzyme substrate complex that breaks to form an enzyme and a product. This is normal. Okay. What does an uncompetitive inhibitor do? Uncompetitive inhibitor binds to both the free enzyme and the enzyme substrate complex. Yeah, that is the feature of uncompetitive inhibitor. It binds to both the free enzyme and the enzyme substrate complex to form enzyme inhibitor complex and enzyme substrate inhibitor complex. Okay. Now, what happens in this case? In this case, how much ever you increase the substrate concentration, you cannot overcome the inhibition. You cannot overcome the inhibition because all these substrates become enzyme substrate complex and all these get diverted to form enzyme substrate inhibitor complex. So the take-home message about uncompetitive inhibitor is increasing the substrate concentration cannot overcome the inhibition. If you cannot overcome the inhibition, the final maximum velocity that is achievable will be low. Is that clear, Chauhan? This is why the final maximum velocity that is achievable is low in the presence of uncompetitive inhibitor. Now, why should Km be low? Okay, watch this carefully. Km is also low in the case of an uncompetitive inhibitor because in this case, an inhibitor binds to enzyme substrate complex, diverting it to form enzyme substrate inhibitor complex. So this side of the equilibrium, the concentration is always kept low. If one side of the equilibrium, the concentration is always kept low, the equilibrium tries to get shifted towards that side. For the equilibrium to get shifted towards that side, enzyme and substrate react with more affinity. So now there is an indirect increase in the affinity. You must have learned that affinity and Km are inversely proportional. Because there is an increase in the affinity, Km is also low. Do you understand this? So Vmax is low because you cannot overcome the inhibition. Km is also low because there is an indirect increase in the affinity between enzyme and the substrates. Clear, Chauhan? Good. Ma'am, how can I know that my marks are improving on the right pace or it is insufficient growth? Please give some cutoff of number of questions that must be correct for one who's preparing for NEET PG 2026. So Tanushri Tibari, so your question is about grant test, I assume, right? So if it's about grant test out of 200 MCQs, you're asking me to give a cutoff, okay? So let me be open about this. Grant test is not for assessing your performance. Grant test is to improve your performance. Do you all understand this? It's to improve your performance. So I'm not going to discourage any one of you who's attending this session by saying that there is a cutoff. And if you don't reach that cutoff, your preparation is bad. Okay. So it is not about the number of questions that you've marked right. It is about how well you're preparing yourself after that. Okay. So it is all about how you prepare or how you review the grant test that you have written. Okay, so do not have any cutoff. Okay, so be open about your mark that you're going to get. Okay, don't worry about that at all. So at the end of grant test, all that you will have to do is look at the mark, compare your this time mark with your previous mark. Even if there is an increase in 1 mark, right, between, even if there is an incremental increase in 1 to 2 marks when compared to the previous exam, then you're on the right path. Okay, and for that to happen, I will tell you in due course what you should do in grant test. Okay, grant test review. So so watch this, Tiwari. I'm going to talk about that in a minute. Okay, why is vitamin K, how do pyruvate carboxylase inhibition leads to alopecia? So there are few clinical features which cannot be explained, right? So, but in the case of pyruvate carboxylase defect, it is all about gluconeogenesis defect. And when gluconeogenesis is affected, almost every part of the body gets affected, right? So though we have a few parts of the body like neurons and RBCs which get affected the most, apart from that, anything which is actively dividing, right, anything which is which is supposed to be growing on a day-to-day basis, that gets affected. And here I would say that pyruvate carboxylase defect does not directly cause alopecia. The coenzyme biotin, right? So biotin is necessary for multiple carboxylases. So whenever there is pyruvate carboxylase defect, it is associated with the reduction in the affinity of biotin for the enzyme. Okay, and that is associated with hair loss. Okay, do you understand this? So that is about why pyruvate carboxylase inhibition can lead to alopecia. It is more of biotin having lesser affinity to all carboxylases. Okay, yeah. Now about how to not hurry in marking the answer, right? So when it comes to this part, okay, what to do during examination. You might have prepared for like 12 months or 11 months or 10 months, okay? But your ultimate success depends upon how mindful you are during the examination. Okay, those 3.5 hours that you're in the examination hall is going to ultimately determine your success. Okay, so I want you to be mindful. Yeah, step number 1 is to ensure that you're being very mindful during the examination. Okay, and number 2, reduce anxiety. Okay, so anxiety reduces productivity and anxiety reduces the efficiency with which your brain works. Okay, number 3, it's all about time management. Yeah, please understand, it's all about time management. So please ensure that you give at least 20 seconds for answering one-liners. Okay, 30 seconds for answering conceptual MCQs. A maximum of 45 seconds can be given for case-based MCQs. So give yourself that liberty. Okay, 20 seconds for one-liners, 30 seconds for conceptual MCQs, 45 seconds for case-based integrated MCQs. Give yourself that liberty. Within that period, what are you going to do? Always read all 4 choices, right? There might be an MCQ which is very clear, which you think you know for sure. For example, they ask you, codon consists of, right? The moment you see the question, codon consists of, you know the answer is 3. Okay, so you're seeing the choice A, which says 3 base pairs. You might end up choosing it, but that's a wrong answer because codon consists of 3 nucleotides. Okay, that is why even if you think choice A is the right answer, go ahead, check choice B, C, and D for any MCQ. Okay, always exclude all other 3 choices. Do you understand this? Always ensure that you exclude all other choices. Okay. So, and another thing that will help you in not making a silly mistake during examination is practicing MCQ. Okay, so it is all about what you have done before your examination, and it's all about what you do during the examination. So before examination, you should have practiced as many MCQs as possible, so that unconsciously you know this is the kind of silly mistake that I've always been doing. Let me not commit the same on the day of examination. Yes, I've done similar MCQ wherein I made a silly mistake. I should ensure that I don't commit the same mistake now. Right? That kind of understanding of your pattern should be in you. That comes purely by practice. Okay. So always check all 4 MCQs, always exclude the other 3 choices. Ascertain yourself that this is the right answer by spending enough time on all MCQs. Does that answer your question? Can you explain the different types of PCR? Okay. So polymerase chain reaction, we have conventional PCR. And that is what we always learn about, right? So this conventional PCR is used for amplification. Do you understand this? Conventional PCR is used for amplification. Whereas real-time PCR, right? Real-time PCR is not used for amplification. It is used for quantification. Have you understood the difference? Conventional PCR is for amplification. Real-time PCR is used for quantification. And then reverse transcriptase PCR. When do we use reverse transcriptase PCR? That is used whenever the nucleic acid of interest to you is an RNA. Okay. Example, SARS-CoV-2 diagnosis. You know, in SARS-CoV-2 diagnosis, from the swab sample, we extract RNA. RNAs cannot be directly amplified. RNAs cannot be directly quantified. So what are you supposed to do? You're supposed to convert RNA to DNA. That is done by reverse transcriptase PCR. So don't get confused between RT-PCR or reverse transcriptase PCR and real-time PCR or qPCR. Okay. And then we have something called as allele-specific PCR. So what is the use of allele-specific PCR? Conventional PCR is used for amplification. In allele-specific PCR, you choose primers in such a way that they're complementary to mutation sites causative of a disease. The primers are so chosen that they're complementary to mutation sites causative of a disease. Okay, following which you allow the PCR to get into action. At the end, if you have a product, right? At the end, if you have a product, it means there is a mutation. At the end, if you don't have a product, it means it is normal. Do you understand this? What have you done here? Here you have done you have chosen primer in such a way that the primer is complementary to mutation sites causative of a disease, so that the primer goes and binds to the allele only when it is defective, and you will get a product only when there is a defective allele. So here, allele-specific amplification is happening to prove diagnosis. So that's about allele-specific PCR. Okay. And then we also have nested PCR. So what is, one second. So what is nested PCR? Suppose I have 2 copies of the same gene which resemble each other, right? For example, GST-M1 and GST-M3. So there are 2 different genes, GST-M1 and GST-M3 in human genome. They resemble each other so much. I want to amplify only GST-M1. In that case, I use what? Nested PCR. So nested PCR increases the specificity. How is it used? One second. Let me add a page for this. So what happens in nested PCR? Suppose this is the entire chromosome of an individual, and suppose this is the GST-M1 gene that I want. Okay, and there is another sequence which is very close to it, which resembles GST-M1. To get exactly what I want, I use 2 sets of primers. One set of primer will be complementary to external part of the flanking sequence. Okay, so these 2 primers may not be specific. So they hybridize to both GSTM1 and GSTM3. And as a result of this, I get two products. Okay, I get two products. But I don't want these yellow fragments. How will I eliminate the yellow fragment? I'm going to use another set of primers which are complementary to internal sequences here, which is very specific only for GSTM1. So as a result of this, I get only GSTM1. This will not get amplified. So why is it called as nested? One set of primer is nested within another set of primer. That's why it's called as nested PCR. So what is nested PCR used for? It is used for increasing the specificity. Got it? So these are the types of PCR that you need to know. Hemalata, has that answered your question? Is always Sanger sequencing considered the gold standard? Sequencing will always be the gold standard for any diagnosis, okay? Because all other diagnostic tests will only give you an indirect evidence of a disease. Whereas if it's Sanger sequencing, you exactly sequence the fragment and will give you the right answer. Okay, so Sanger sequencing, if you see in the choice, it can be considered as a gold standard most of the times. The cherry red spots are present in Gauchers. Yes. So I have always given you a mnemonic, right? The mnemonic is no cherry red spot in KGF. I've given you this mnemonic, no cherry red spot in KGF. I've told you it is Krabs disease, Gaucher's disease, and Fabry's disease. And whenever I tell you this, I would say this is the classical infantile Gaucher's. Yeah, in the classical infantile Gauchers, you don't see cherry red spot. But in all other types of Gauchers, you can see cherry red spot. Okay, and most of the times, whatever history that they give you with anemia, neutropenia, crumpled tissue paper appearance, that's a classical infantile type that does not present with cherry red spot. Has that answered your question? I didn't prepare anything till now. Shauhan, if you have understood it, please say yes or no. I didn't prepare anything till now. In 9 months, is it possible to understand from now? Akash, I'm a strong believer of the fact that nothing is impossible. Okay, and you are at a good position because you have 9 more months, right? So 9 more months is good enough for anybody to crack NEET PG. I always say this to all students, please don't worry about the way you've learnt your undergraduation days. That does not matter anymore. Okay, so these 9 months, just be systematic, just be consistent, just have a schedule for yourself, stick to that schedule, choose a right resource for you. Okay, and stick to that resource. You will be able to succeed in this. Okay, Akash, yes, you can do it for sure. Why is the temperature and annealing part of PCR often variable? Yes, it is variable. Let me tell you why. Because in annealing temperature, right? So it's all about annealing temperature. Suppose this is the entire chromosome and you want only this fragment of the chromosome. You get exactly this part of the chromosome by constructing primers. Okay, and how do you choose primers? You choose primers in such a way that they're complementary to the flanking sequences of the desired fragment. So when primers go and anneal here, this step is called as annealing step. And this annealing step has to be 5 degrees less than the melting temperature of your primers. Do you understand this? Annealing step temperature has to be 5 degrees less than the melting temperature of your primers. For example, if the melting temperature of one primer happens to be 64 degree, melting temperature of the other primer happens to be 66 degree, the average between 64 and 66 is 65. Okay, 5 degrees less than 65 is 60. So for this example, annealing temperature will be 60 degree. Okay, but what if this primer has a different melting temperature? Say 57 degree, and this happens to be say 60 degree. Okay, take an average of 57 and 60 degree. It is going to be 58.5. Okay, 5 degrees less than 58.5 will be 53.5. So in this case, the annealing temperature has to be 53.5. So it varies based on the melting temperature of primers that you have chosen. So it's not a fixed value. Do you understand that, Sarkar? Good. Now, this question has been asked multiple times. When to give grant tests after preparing some subjects or randomly? So the answer is, right, you don't have to wait for you to complete preparation of even one subject for you to start writing a grant test. When should you start writing grant tests, right? Like Akash. If Akash is starting to prepare from tomorrow, okay, when should he attempt the first grant test? Tomorrow. Okay, even before you start preparing, start writing grant test. Because as I told you already, grant test is not to assess your performance, it is to improve your performance. Okay, so the major advantage of you writing a grant test is you will get to know what kind of MCQs or what kind of topics are being questioned on in every subject. Because as far as NEET PG and INI-CET or FMGE exam preparation is concerned, it is all about smart work. Nobody can finish all 19 subjects, right? So you should know exactly what are the topics you should focus on. And that understanding does not happen all of a sudden. Only when you write multiple grant tests, you will know, okay, if anesthesia is the subject, these are the topics that I should focus. If biochemistry is a subject, these are the topics that I should focus. And for that understanding, you will have to start by writing grant test. Okay, and also to assess how you're improving during the preparation phase, you will have to start the day one by writing a grant test. Okay, so for all of you who are attending this session, please ensure that you write one grant test every 20 days. Okay, write one grant test every 20 days. So if day one you're writing one grant test, if day one you're writing one grant test, day 21 you're writing the next grant test. What will you do in the 20 days in between? In the 20 days in between, you divide 200 MCQs into 20 days. Every grant test usually has 200 MCQs. So every day you're going to attempt 10 MCQs. When I say attempt, you're going to read about those 10 MCQs, right? So 10 MCQs in the sense you'll have to read those 10 MCQs as 10 topics, okay? Irrespective of the subject it is related to. So day one, you have written one grant test. You wrote for 3.5 hours. You attempted 200 MCQs. You know how many questions you got right, how many questions you got wrong. You just have an understanding of that. After that, day two, question number 1 till question number 10, you're going to read, right? You read every question as one topic. That way, you will be in touch with all 19 subjects throughout, right? That will help you in spaced repetition every now and then, okay? So do this religiously, you will come back and thank me, okay? So that's about writing a grant test. Type 5 hyperlipoproteinemia, cholesterol level increases or does it remain the same? In type 4 and type 5, okay, type 4 and type 5 are called as familial hypertriglyceridemias. So triglyceride levels are elevated. Mostly cholesterol level will be normal, but that does not mean if cholesterol level is marginally elevated, you can exclude type 5. Because what is type 5 is, type 4 person with a superimposed or a precipitating factor for hypertriglyceridemia. An obese person with type 4 will present as type 5. And that obesity can cause hypercholesterolemia. Do you understand this? The actual genetic defect will cause only hypertriglyceridemia. But if there is any other precipitating factor, that can also be hypercholesterolemia. But as such, the disorder does not cause hypercholesterolemia. Okay, Sarkar has another question. Why doesn't counter-regulatory hormones respond? Why doesn't von Gierke's disease respond to counter-regulatory hormone administration? Because von Gierke's disease is a defect of glucose 6-phosphatase, and glucose 6-phosphatase is an enzyme that is common to both glycogenolysis and gluconeogenesis. Okay, glucose 6-phosphatase is common to both glycogenolysis and gluconeogenesis. And all these counter-regulatory hormones do not have any magic to increase blood glucose. They increase blood glucose only by stimulating glycogenolysis and gluconeogenesis. In von Gierke's disease, both these pathways are not active, and that is why von Gierke's disease does not respond to counter-regulatory hormone administration. I hope that helps, Sarkar. Yes. So next question. What tags to include in the custom module? Okay. So I would say custom module that is available on the PrepLadder app is a boon, right? It's a boon to everybody who's preparing for this examination. Because whenever I meet students keep asking me what should be the resource that I use for practicing MCQ. I would say this custom module would be the best resource for you to practice MCQ. Okay, so for those of you who have joined the session, I don't know how familiar are you in using this app. For all of you, let me tell you how to use this custom module. Okay, so on this app, can I access the session as recorded video afterwards too? Yes, Arshad, you will be able to do it. Okay, so custom module, where should you go? You should go to Qbank section. When you go to Qbank section, you will see something called as custom module. So click that. Once you click custom module, there will be something which is asking you to create a module. Click create module, then you will see this option. It will ask you whether to go with Qbank mode or test mode. So the difference between these two modes is in Qbank mode, as soon as you choose the right answer, right? As soon as you choose the answer that you think is right, immediately it will show you the right answer. It will also give you an explanation. Okay. I strongly recommend that you use the test mode. So what if you choose the test mode? If you choose the test mode, suppose you're writing a test for 50 MCQs. You don't see the answer immediately. You will have to write or attempt all 50 MCQs. At the end, you will get to see the answer. At the end, you will get to see the explanation. So my recommendation to all of you to choose is to choose the test mode. Okay, so when you choose, because if you're going to see the answer after every question, you get demotivated or you get elated, right? And all these emotions will cloud your ability to answer an MCQ. So don't go to Qbank mode. I recommend that you choose test mode. Okay, when you choose test mode, it will ask you whether you want NEET PG question paper or INI-CET question paper, or do you want a custom test. Okay, so this choice depends upon whether you're going to write a grand test, or you're going to write a subject-wise test, or you're going to write a topic-wise test. If you're going to write a grand test, I told you write one grand test every 20 days, right? So if you're going to write a grand test, choose NEET PG paper, in which case you will be given 200 MCQs. In INI-CET also 200 MCQs. There will be a timer which tells you about the timing. So you'll be able to finish that grand test if you choose NEET PG or INI-CET. Okay. Whereas if you're going to write a subject-wise or topic-wise test, then you choose custom test. So once you choose custom test, then it will be asking you for few choices to be made. It will ask you how many questions do you want in the test. It will ask you what is the level of difficulty you want. And it will ask you whether the app should choose already attempted question or unattempted question. So all these choices will appear. Okay. So I would recommend that for any test paper, choose 50 MCQs, minimum 50. Okay. Level of difficulty, always go for moderate difficulty. Don't keep it so simple. Don't keep it too difficult. Don't get elated. Don't get depressed. It has to be moderate difficulty. And between attempted, unattempted, incorrect and bookmarked, I would ask you to choose unattempted, because more the number of MCQs that you face new, better will be your ability to recall. Okay. Unattempted and incorrect question. That is what I would choose. Okay. Unattempted. Already I've made this mistake. Let me see if I'm making the same mistake or if I'm making it right. So choose unattempted and incorrect question. And once you choose this, now comes subjects. So if you're writing one subject test, for example, you've finished biochemistry in 10 days. You think you're done with biochemistry. You want to check how well have you prepared. Choose biochemistry. Or if you want a cumulative test, so you're starting to prepare from tomorrow, You finished anatomy, physiology, biochemistry. At the end, you want to see how well have you prepared for anatomy, physiology, and biochemistry. Then choose anatomy, physiology, and biochemistry. Do you understand this? So now you're going to choose the subject. And after you choose the subject, then comes tags. So the two tags that you will be shown is system tag and exam tag. For exam tag, I recommend that you choose everything. Okay, because exam tag means it is asking you, do you want NEET PG questions alone, or do you want INI-CET questions alone? Do you want case-based questions alone, image-based questions alone? I would say the question paper that you attempt should have a mix of all these MCQs. Okay, for system tag, I would recommend that choose no system, which means it is not going to specify only one system. It is going to mix and match all system questions. Okay, so I would choose no system tag. That's all. Okay, these are the choices that you have to make. Once you're done with all this, you will be given a question paper. You can start writing it. Do you all understand this? So this is about what you need to do to use custom module. Please use this custom module. It's a boon for all PrepLadder subscribers. Okay. So let me try to answer a few questions that are asked here. Gene knockout and knockdown. Can you brief about miRNA mediated gene silencing? So two questions are the same. miRNA and gene knockdown, both are same. Okay, because what does miRNA do? miRNA or microRNA is a precursor of siRNA. And siRNA is small interference RNA that interferes with gene expression. Okay, when I say it interferes with gene expression, I mean to say it down-regulates the gene expression. Do you understand this? It down-regulates the gene expression. So that causes gene knockdown. Okay, so all of you understand this. siRNA, the precursor of siRNA is miRNA. miRNA and siRNA take part in interference phenomenon, wherein they interfere with gene expression. They down-regulate the gene expression that causes gene knockdown. Okay, now what is knockout? Knockout is a gene editing mechanism where you remove the defective gene. Do you understand this? Knockout is a gene editing mechanism wherein you remove the defective gene. And that is done by CRISPR mediated gene editing mechanism. Knockout is done by CRISPR mediated gene editing mechanism. That's about the difference between knockout and knockdown. Okay. So I've addressed Hemalata's question and Sarkar's question. Is CRISPR-Cas9 the same as Feluda test? So Feluda test is one of the applications of Cas9 enzyme. Do you understand this? Feluda test is one of the applications of Cas9 enzyme. So Cas9 is used for diagnostics and Feluda is not used anymore now. It is a diagnostic test that came up with Cas9 enzyme. Okay. It is not the same. Cas9 can be used for many other applications. So how to make concise notes having all the relevant topics with necessary concepts that could be revisable in half a day before examination, right? So how to make concise notes for any subject, right? For all 19 subjects, you should have a cheat notebook, right? What do you call it as? You call it as a cheat notebook. And I would recommend that for this cheat notebook, you buy a 5-subject book. You know that, right? There are notebooks which are called as 5-subject notebooks, which means they have 5 segregations in that notebook. Okay. So what is the first segregation used for? The first segregation has to be used for facts. So what do I mean by facts? Suppose you're learning biochemistry, you're writing biochemistry concise notes. So first page is all about rate limiting enzymes. So as you learn every pathway, you're noting down the rate limiting enzyme in page 1. Page 2, you're noting down about energetics, glycolysis, aerobic glycolysis 7 ATPs, anaerobic glycolysis 2 ATPs. And then you will be learning about inhibitors. So every enzyme inhibitor, as and when you come across one enzyme and its inhibitor, you're going to turn that page, you're going to note it down. So you have a long list of facts that get built this way. And then another example for fact is pattern of inheritance, right? Oxidative phosphorylation steps, oxidative decarboxylation steps, sources of NADPH, sources of FADH2. So any list that you come across, you consider that list as factual fact. And those will go to the first segregation of the notebook. So subject 1 is for facts. Subject 2 is for differences between. Right. So as you learn biochemistry, you will be learning about all differences between. For example, hexokinase, glucokinase difference. Right. And then competitive inhibition, uncompetitive inhibition difference. What is the difference between DNA and RNA? What is the difference between DNA polymerase and RNA polymerase? So whenever you're learning carbamyl phosphate synthetase 1 and carbamyl phosphate synthetase 2. So whenever you learn about any difference between, you're going to turn to that part of the notebook. You're going to write down that difference between legibly. You don't have to be artistic, but it has to be legible. Okay, that will be for subject 2. And then the third part, right? The third part is only for inborn errors of metabolism, wherein you learn about glycogen storage disorders. You're looking at the video on glycogen storage disorder. I'm giving you a mental algorithm. You're writing down that mental algorithm. And then you're learning a mnemonic related to inborn error of metabolism. No cherry red spot in KGF. Note it down. So the third part is only for inborn errors of metabolism. Okay. Now the fourth part will be for formulae. What are the formulas that you read in biochemistry? We have Michaelis-Menten equation, Henderson-Hasselbalch equation, right? So all these equations will have to be memorized. Not just this, right? When you learn about acid-base balance, I would have told you about Winter's formula. What is the compensation formula for metabolic alkalosis? Compensation formula for respiratory acidosis, for respiratory alkalosis. What is the formula for anion gap? Plasma anion gap, urinary anion gap. So all these formulae you're going to write down in the fourth part. The last part is what I love the most. Okay, the last part is for why. Okay, you're learning why does alcoholism cause hypoglycemia? Why does vitamin B12 deficiency cause neurological manifestations? Why does thiamine deficiency cause beriberi? Right? Why does it cause wet beriberi? Why does it cause dry beriberi? I've explained all this in my videos. Right? So whenever you learn about why, for example, I've also told you why should you use sodium benzoate for hyperammonemia? So all those whys you write down. Okay. So when you write, it will make you more happy. Okay. Because you're noting down all these facts legibly so that the day before exam, you're going to use this note alone to revise all facts, to revise all concepts, to revise all disorders. This will be a cheat notebook that will help you to finish the entire revision in half a day. Is that clear? Yes. What to concentrate in genetics for the upcoming INI-CET. So not only for the upcoming INI-CET, for any INI-CET, I have a list of topics that you will have to read. So wait for some time, we will discuss about that. Yeah. What are the topics where main videos are necessary to watch? I'm very happy that a student has asked this question through the Google form. Okay, because I've never been able to reach out to all students to say that even if you watch only rapid revision videos, please ensure that you watch these main videos, right? So have a note of these topics. So these are the topics from the main video that I recommend, strongly recommend that you watch from the main part. Okay, transport and receptors. I've explained in detail about types of transporters, types of receptors, example of receptors, and then a shortcut to remember all those receptors. And then hemoglobin and myoglobin. Please watch the video on hemoglobin and myoglobin, because that is where I've explained what is Bohr effect, what is Haldane effect, what is cooperative binding, oxyhemoglobin dissociation curve, right? What is the significance of 2,3-DPG? So this is not seen in rapid revision videos. It is seen only in main video. Similarly, in amino acid metabolism, watch the video on urea cycle and urea cycle disorders. Okay, it is not seen in rapid revision. LRR, I've explained, okay, not in the rapid revision video of PrepLadder app. So if you're watching rapid revision video of PrepLadder, go to main video and watch urea cycle and urea cycle disorders. Similarly, the types of hyperbilirubinemias, how to make a diagnosis, watch from the main video section. Minerals, I've explained all about iron, I've explained all about calcium, I've explained all about all other minerals and high yield MCQs on minerals. So these are the topics that I want you to watch in the main video section. I hope you've all noted down this. Yeah, so this, I mean, all these are high yield topics. Which standard books are useful for biochemistry for NEET PG? Okay, so this is a controversial question. If you ask me, okay, practically speaking, you will not be able to use any standard, I mean, any textbook. You will not be having enough time to use any textbook for your NEET PG preparation. Okay, but if you want to have one textbook as a fallback, if you want to read a particular topic from the book, okay, then I would recommend Harper or Lippincott. Okay, what do I recommend? I recommend Harper or Lippincott. But if you're not a Prof 1 student, if you're preparing for NEET PG or INI-CET or FMGE, you will not get time to read anything from textbook. Okay, everything is there in our videos, everything is there in the notes that is provided to you. Okay, so otherwise, if you want me to talk, it is Harper and Lippincott. How to recall biochemistry, mainly the name of amino acid metabolism enzymes. So recalling biochemistry or recalling anatomy or pathology or pharmacology will not make any difference, right? So as I told you, it has to be an active recall that you do by working out MCQs and by writing multiple custom module tests and by writing multiple grant tests. And if your main question is about amino acid metabolism enzyme, in all my videos, I have told you, I've insisted that do not memorize any structure, right? For carbohydrates, you don't have to memorize any structure. For lipids, you don't have to memorize any structure. But for amino acids, I recommend that you understand, you spend some time in understanding the structure of all these amino acids. I am recommending that because learning the structure of amino acid is very easy. Okay, I told that shortcut also in the video. And once you know the structure of amino acid, you will be able to understand most of the metabolic pathways and the enzymes. Okay, and another shortcut that you should remember is most of the amino acids metabolism will be initiated by a transaminase. Phenylalanine, minor fate is initiated by a transaminase. Phenylalanine becomes phenylpyruvate. Tyrosine, initiated by tyrosine transaminase. Ornithine, metabolism initiated by ornithine transaminase. So this is one shortcut that I can give you. Most of the amino acids metabolism will start with the transaminase. Otherwise, if you have a basic understanding of the structure of amino acid, learning the metabolism will be simple. And even in main video and PrepLadder for amino acid metabolism, it is just like 2 to 3 hours video, maximum 3 hours video, okay, which you can quickly watch. And I've given all shortcuts to remember everything. And at the end, you will have confidence to face any MCQ on this topic. Okay. How to start biochemistry in a smart way, right? So any exam preparation, it is not just about hard work, it is about smart work. And as far as biochemistry is concerned, the smarter way to start biochemistry preparation is having the right sequence of preparation, right? What do you mean by right sequence? Always start learning biochemistry by learning cell. Do not keep jumping. Just because you know that there are many MCQs which are asked in vitamins, don't start learning vitamins when you start learning biochemistry. because you will not understand vitamins if you don't know metabolism. Okay, so the sequence in which you learn matters a lot in biochemistry. So start from cell and then watch the video on carbohydrate chemistry. Okay, so carbohydrate chemistry videos should be followed by carbohydrate metabolism videos. Following that, you're going to watch lipid chemistry and lipid metabolism videos. Okay, and that obviously should be followed by amino acid and protein chemistry and metabolism. After learning all this, please watch the video on enzymes, because already I've learned about all enzymes involved in all pathways. So now you start learning about what are enzymes, how are they classified, and how do they act. You will be able to understand it better. Okay, so watch the video on enzymes. After finishing enzymes, watch electron transport chain video, and then you will have to watch the video on heme synthesis and porphyrias. Okay, once you're done with all this, finally you can go to genetics. Okay, after finishing genetics, yes, vitamins. So please try to learn. This is how it is arranged in the app. Okay, so after finishing genetics, learn about vitamins. Now if you learn about fat soluble vitamins and water soluble vitamins, you will be able to relate it to better, because you've already learned metabolism. Okay, after vitamins, it is minerals. Then you can watch hyperbilirubinemia and ABG. Okay, so follow the sequence. That will be the smarter way of preparation. And apart from this, the resource that you choose. Okay, watch videos, work out MCQs, write grant test, keep repeatedly learning the same fact and same concept. Get involved. Yeah, what did I tell you? Get involved in active recall. Okay, so these are the smarter ways to prepare for biochemistry. Cheat codes for remembering electron transport chain inhibitors. I've told you this in the video, right? So complex 1 to Q, right? Complex 1 to Q, the electron transport is inhibited by amobarbital. How can you remember this? Amobarbital, pyrisidin A and rotenone. Okay, how to remember this? Complex 1. The first alphabet is A. So amobarbital, the next A, pyrisidin A, rotenone. Rotenone is not vitamin A, but it resembles vitamin A, right? Vitamin A is retinol, retinal, and retinoic acid. So between complex 1 and Q, everything has got something to do with A. Amobarbital starts with A, pyrisidin A ends with A, rotenone sounds like vitamin A. Okay, and then complex 2 to Q. 2 starts with T, right? 2 starts with T. So 2 to Q is inhibited by TTFA and carboxyl. After this, from Q, it goes to complex 3. Electron transport between complex 3 and C is inhibited by a 3-letter word, right? Between 3 and C is inhibited by a 3-letter word, which is BAL and antimycin. It is inhibited by BAL and antimycin. And then 4. Between 4 and oxygen is inhibited by common poisons. What are the common poisons? Hydrogen sulfide, cyanide, and carbon monoxide. Okay, hydrogen sulfide, cyanide, and carbon monoxide inhibit electron transport between 4 and oxygen. So these are the cheat codes. 1, everything to do with A. 2, TTFA and carboxyl. 3, 3-letter word, BAL and antimycin. 4 and oxygen, hydrogen sulfide, cyanide, and carbon monoxide. Okay. Now the next question, what is good for exam preparation? Qbank or daily MCQs? For exam preparation, I would say you're going to use your grant test, which is being done on a regular basis once every 20 days. Later on towards the examination, you can do one grant test every 10 days. Apart from this, every day you're going to work out MCQs. Okay, so it is all about writing granters. It's all about writing daily MCQs. That will help you to prepare for your exam. Should I start practicing MCQs from day one, or should I focus on short answer questions for university exam? So I'm assuming that this question was asked by a Prof 1 student. If you're a Prof 1 student, you don't have to start practicing MCQs from day one. Or let me refine my answer. You should not only stick to practicing MCQs from day one, right? You can start practicing, but you should supplement, right? You should supplement it with answering short answer questions. Okay, because you're going to face a university exam, which is a subjective examination. So you should be able to write down conceptual answers, and that ability comes only by practice. And that practice only when you focus on short answer questions as well. Okay, so do not limit yourself to practicing MCQs. Yes, you can start practicing MCQs from day one, but from day one, you should also focus on short answer questions. Okay. Last minute flashcards to be revised. I'm going to consider this as a repeat question, right? So did I already tell you how to write or how to have a cheat notebook? So in that cheat notebook, you have written down all facts. You have written down all differences between. You have written down all about inborn errors of metabolism. And then you wrote down all about whys, formulae. Everything is segregated. Everything is written. And that is the flashcard that you're going to use for last minute revision. Should I stick to LRR one-liners for the end minute brush up? So for the end minute brush up, yes, LRR, one-liners and image-based questions, right? You will find videos on LRR, image-based questions and one-liners. That will be more than enough for your last minute brush up, apart from the notebook that you have, okay? If you have not made one such notebook, then we are here to support you. Watch these videos. How to not forget important tables in biochemistry. Again, a repeat question, right? If you do not want to forget something, it has to be repeatedly recollected. It is all about active recall. It is all about spaced repetition. And of course, you can have mnemonics. But just because you have mnemonics, it does not mean you will be able to remember it if you don't repeatedly revise it. So it's all about repetitive revision. It is all about active recall. It is all about having shortcuts. But what is more important is you should know the big picture, right? For example, if it's a table on urea cycle disorder, if you don't know normal urea cycle, you will not know what happens when those enzymes are defective. And you cannot memorize the entire table. How many ever shortcuts you use, you will not be able to memorize the entire table. So learn every topic conceptually. Active recall is essential, spaced repetition is essential, and you can use shortcuts. Okay. How many questions should I do per day for biochemistry? If you're learning biochemistry for the first time by watching videos, right? By watching main video. For every main video, we have from 15 to 25 MCQs. So work out those 15 to 25 MCQs. How many ever topics you've finished for that day, the corresponding MCQs will have to be finished. So it's not about the number, it is about the number of topics that you have finished. Those topic MCQs you should have finished. And minimum of 50 MCQs is what I recommend when you're preparing for a subject. How to prepare molecular biology for INI-CET. So INI-CET molecular biology is all about techniques, right? When it is about techniques, I already told you about PCR. You will have to learn about PCR. You will have to learn about RFLP. You will have to learn about Sanger sequencing, right? The principle that is used in Sanger sequencing. Cytogenetic technique, FISH, you will have to learn. Cloning technique, recombinant DNA technology should be learnt. And apart from this, you should also learn in and out about lactoperon. Okay. And for you to understand all these techniques, please don't go and start learning all these techniques from the beginning, right? What should you do? First, you should have a basic understanding of genetics. Learn genetics from the very basic fact. Understand what is a nitrogenous base, understand what is a nucleoside, understand what is a nucleotide, understand what is a polynucleotide chain, right? So only when you know the basic facts and concepts, you will be able to understand all these application aspects. So when you start learning from these techniques will sound like so complicated. But once your concepts are clear, understanding this will be very simple. So again, the entire biochemistry, even if you watch main videos, right? Even if you watch main videos, the entire biochemistry is going to be only for 55 hours. And watching 55 hours in just 10 days is not going to be very difficult for you. So spend those 10 days. One second. My app has stopped. One second. So spend those 10 days. It will be a valuable time that you're investing to learn biochemistry. And once you're done with that, then you're very clear. Okay. So that's about preparing for molecular biology. Should I refer to textbook or PrepLadder notes at end time or return notes? Again, a repeat question. I said you don't have to refer to textbook. That is going to be practically impossible. Okay. So watch videos, use PrepLadder notes. When it comes to PrepLadder notes, also use RR notes. Okay. So yes, you will be getting your RR notes soon. And this RR notes is in the form of question and explanation. So it is written in the form of question and explanation mode. So there is a question that makes you think, and then there is an explanation. Okay. So that will help you to get involved in active learning process. So use that notes also. And apart from that, as I told you, have your own handwritten cheat notebook for last minute preparation. How to approach one-liners, ma'am? The options seem so confusing. Okay, so to answer one-liners, as I told you, you'll have to spend at least 20 seconds. And apart from that, let me give you 2 clues to answer one-liners. The first clue is the examiner always gives you a close distractor. Right? What does the examiner always do? The examiner always gives you a close distractor to the right answer as one of the choices. So when you see 2 choices to resemble each other, okay, then one of the 2 is the right answer. That way you can exclude 2 other choices. Now you will have to pick one and the 2. Do you understand this? So that way you can write one answer one-liner. Another way of approaching one-liner is whenever you see a very assertive statement, right? Whenever you see an assertive statement that is false. For example, complete removal of introns, total absence of exons. So whenever you see such assertive statements, you can exclude that from choices. Okay. And apart from this, as I told you, if it's a one-liner, make an educated guess for a possible or potential right answer, and then exclude all other choices. Okay. And then try your luck. But my advice to all of you is to not skip any question. Right? Attempt as many questions as possible in your final examination, because till date it has been statistically proven that those who have attended more number of MCQs have always scored well. Okay, so the answer has to be chosen by educated guess. How should I go about reading standard books line by line? Which book should I read? The same question, right? Standard textbooks, no line by line reading is not going to be possible. It's not possible even for me, right? Even for me to finish the entire Harper, if I'm going to read for 20 days or 30 days, I'm not going to be able to finish. So don't even do something which is practically impossible. Okay? Do not do it. And which book should I read? If at all you're reading a book, it should be Harper or it should be Lippincott. Should I rely on PrepLadder rapid revision notes, PrepLadder notes plus rapid revision notes, or make my own handwritten notes? If self notes, what exactly to include? Is this flow correct? So I've already answered the first part. Yes, When you're watching main video, you read PrepLadder notes. When you're watching rapid revision videos, watch rapid revision notes. As you're doing this, also write your own handwritten notebooks. And then I told you how to write self notes. Okay. And the person has asked, is this flow correct? Video to be followed by app notes, followed by standard books, no standard books, self notes. Yes, that is right. How to use PrepLadder Qbank after lecture? This is also a repeat question, right? 1 second. So this is also a repeat question, which I already answered. Question bank after lecture. As I told you, after lecture, for every video, we have given 15 to 25 MCQs. Watch that. Cumulatively for every, I can't call it as a concept, cumulatively for every section, right? For every section, we have given PYQs, use that. And when it comes to Qbank, the greatest advantage of PrepLadder Qbank is you have audio explanation, right? So the advantage of having an audio explanation is you can listen to it on the go. So you have to be in a place watching video. Once you're done watching video, you can keep moving around. You can have this audio explanation giving you the right answer. So try to finish as many MCQs as possible that is given in the Qbank. And always attempt custom modules so that you're able to verify how much of it you're able to retain. And then look at those explanations as well. Okay. Which source is best for mastering biochemistry, right? So you're asking me that question. I would say the best resource for mastering biochemistry would be my main videos, my rapid revision videos. When I say my on PrepLadder, because we have put enough efforts into it to understand what are the topics that have been asked previously. Right? So jokes apart, I'm being very serious about it. Watch main videos, rapid revision videos, use notes, work out MCQs, work out the Qbank, work out custom module. You can be, my assurance, right? My assurance to you is more than 95% of MCQs that are asked in biochemistry and clinical biochemistry, you will be able to answer because we have put in that many efforts to come up with this. How to approach biochemistry for NEET PG and remember difficult cycles? Answer remains the same, right? Remember difficult cycles, it is spaced repetition and active recall. Is practicing PYQ enough from now onwards? I don't understand which exam you're going to appear for. If you're going to appear for the upcoming INI-CET November exam, yes, PYQ is enough. Right? But if you're preparing for your NEET PG exam, then PYQ is not enough, right? You will have to work out as many MCQs as possible. How much time exactly should I give for biochemistry so that I can crack almost 15 to 17 marks? So I already gave you the answer. It is 55 videos that we have in biochemistry, which you can definitely finish comfortably in 10 days. Right? Comfortably in 10 days you can finish by working out MCQs simultaneously. Okay, so that is the time that you will have to spend. And once you are done with this, for the first revision that you're going to do, watch rapid revision videos. For the second revision that you're going to do, watch LRR, image-based questions and one-liners. You're done. You're sorted. You will definitely get those 15 to 17 marks. Give me some tricks to remember stuff even after multiple revisions. I get confused. Or anxiety makes me confuse the concept of enzymes deficiencies. Right? So as I already told you, anxiety reduces productivity. Okay? So take off that anxiety from the equation. How can you take it off from the equation? Please be assured, right? You have a PG seat reserved for you. Because 1 in 3 NEET PG aspirant has a seat. Okay, so we have so many seats that are available, but we find it difficult to get a seat because all of us are focused on very few selected branches. Okay, so have your choices wide open. Not everybody needs to get into radio diagnosis to be successful in life. Not everybody should get into dermatology to have a work-life balance. Not everybody should become a surgeon or an orthopedic surgeon to have enough money. Right? So every field is gratifying, every field is monetarily great. Okay, it is all that you will have to put in passion into that field. So you have so many choices. So remove that anxiety from your mind. Okay, be cool about what you're doing, enjoy what you're doing, not just during preparation, even on the day of examination. Right? So on the day of examination, just keep telling yourself, I have a seat. I'm going to be 1 and 3rd who will have a seat that is assured. Okay, so once you have that in mind, anxiety is removed off. Okay, so be relaxed, be mindful during the examination. That will help you to exclude all silly mistakes that you make on the day of examination. What to study for genetics is already discussed. Okay. Okay, I didn't expect this question. This is not a session for me to explain entirely about transcription and translation, because transcription discussion alone will take 45 minutes, translation 1 hour, and I'm sure that is not going to be possible in Ask Me Anything session. But because it is Ask Me Anything session, let me just give you an outline of transcription. Transcription is a process by which a double-stranded gene is converted to single-stranded RNA. Right? Transcription is a process by which a double-stranded gene gets converted to single-stranded RNA. Now, what is translation? Translation is a process by which ribosome reads this RNA, converts this RNA or translates this RNA as a polypeptide chain. So why is it called as translation process? In translation process, you translate nucleotide sequences of mRNA into amino acid sequences of a polypeptide chain. So that is about what is transcription and what is translation. This is all I can manage when it comes to Ask Me Anything session. Okay. What are the clinical conditions related to fatty acid oxidation and also lysosomal storage disorders, and how to remember? So fatty acid oxidation defect, this has been explained in main video. Fatty acid oxidation defect can be congenital or inherited defects. It can be acquired defects as well. There are 2 types, congenital or inherited and acquired. Congenital or inherited will include any of the defects of enzymes involved in fatty acid oxidation. Example will be medium chain acyl-CoA dehydrogenase defect. Right? Medium chain acyl-CoA dehydrogenase defect. Acquired causes can be Jamaican vomiting sickness. Right? Jamaican vomiting sickness caused by the intake of unripe ackee fruit. So that is about fatty acid oxidation defect. Lysosomal storage disorders. We have a long list of lysosomal storage disorders. Please watch my session on glycosphingolipidosis and you will be able to get many shortcuts on how to remember all these disorders. Okay. So I will not be able to explain that in this session, but watch that video, you'll be able to understand it. How to approach questions on DNA polymerase or clinofragment. Example, given a DNA sequence, find the RNA transcript. So this is one question, this is another question. Okay, so clinofragment is a part of DNA polymerase which does not have 5'3' exonuclease activity. Yeah, this is one fact that you should remember. What is clinofragment? It's a fragment of DNA polymerase without 5'3' exonuclease activity. For now, if you know that, that is enough. Because with 5'3' exonuclease activity, it cannot take part in PCR. So we have removed 5'3' exonuclease activity. The remaining clinofragment is used for PCR. Another question, given a DNA sequence, find the RNA transcript. So whenever they give you a DNA sequence, check if it's a template strand sequence. So if they give you template strand sequence, check the polarity in which they have given you the template strand sequence. Here they have not specified the polarity. If they have not specified the polarity, it means it is in 5' 3' direction. The rule in genetics is you have to write any polynucleotide chain only in 5' 3' direction. So if the question does not mention the polarity, it is implied that it is in 5' 3' direction. Okay. Now, if it's template strand sequence, you have to write it in 3' 5' direction. So if you write it in 3' 5' direction, it becomes CAT CTAG. So this is the template strand sequence that is given in the question. To find out RNA sequence, write complementary sequences. So when you write complementary sequences, for C it is G, for A it is U, T it is A, G, A, U, C. I have written complementary sequences. I am going to mark it as 5' 3'. So that will be the RNA sequence if this is the template strand sequence. Okay. What if they give you coding strand sequence? If it is a coding strand sequence, don't change polarity, don't change the sequence. Retain everything. Just replace T by U. So if the question is coding strand sequence, then the answer is 5' GAU, right? 5' GAU, CUAC 3'. So it all depends on whether they've given you template strand sequence or coding strand sequence. If it is template strand sequence, change the polarity, write complementary sequences, mark it as 5' 3'. If it's coding strand sequence, don't change anything, just replace T by U. Okay. I hope it has given you the answer. So that's all for today. So these are the questions that were asked, and I hope I've helped you answer as many questions as possible. I've answered all questions which were given on the given through the Google form, and those questions which have been asked in the live chat. Hope all of you enjoyed the session, and my best wishes. I'm very sure you'll be successful if you stay positive, right? So the major secret here is being positive. Yeah, thank you.